Hello everyone, it's Taha. I'm a fourth year medical student, and in this video we are going to go over the investigations for appendicitis. So in previous videos we've had a look at the pathophysiology of appendicitis and the clinical presentation, and in today's video we're going to go over the different investigations that are actually available to patients coming in with suspected appendicitis. So let's just jump straight into the video. So like always, Mr. Whitecoat, our beloved patient, is back. So Mr. Whitecoat came in with appendicitis. Let's have a look at the investigation procedures that are actually available to him. So what we need to understand about appendicitis is that it is primarily a clinical diagnosis, right? Now, what is a clinical diagnosis? A clinical diagnosis simply means that the diagnosis is made based on the signs and symptoms the patient actually presents with, rather than using specific diagnostic tools and testing, right? What that being said, like a lot of things in medicine, it is very patient dependent, right? So based on the patient's age, their gender, and the likelihood of appendicitis, we have different diagnostic tools and imaging that are actually available to us that can exclude or also confirm the possibility of appendicitis, right? So let's have a look at what those investigation techniques may be. So let's say you have a patient that comes in with the with the typical signs and symptoms of appendicitis, so the right lower quadrant pain. They may experiencing nausea, vomiting, low grade fever sort of thing. The very first thing that we're going to do is obviously take a thorough history from the patient, right? And we're also going to do an abdominal examination, right? Now, we've gone through the clinical, presentation of appendicitis in the previous video, but just to quickly mention the sort of things that you may see on an abdominal examination in a patient with suspected appendicitis. So you may see tenderness, again, of the right lower quadrant, right? Now, specifically, it's going to be rebound tenderness and percussion tenderness. Right, so rebound tenderness just meaning when you press down on the patient's right lower quadrant and you release, and if there's pain on that release, that means there's rebound tenderness, right? You may also see guarding, right? Now, guarding is simply just where the abdominal muscles around that area, so the right lower quadrant, they tense up, right, involuntarily, and this may be due to the underlying inflammation of the peritoneum itself, which may cause the muscles to tense up, right? And the other thing that we can see is Rovsing sign. We've also mentioned this before. So Rovsing sign is just palpation of the left lower quadrant can cause pain of the right lower quadrant where the appendix actually lies, right? So this is the sort of things that you'd see on an abdominal examination, right? Now, in terms of testing, right? So the different tests that we can do, what can we actually do? So the first thing we'll do is a blood test, right? Now, what sort of things are we expecting to see on a blood test in a patient with suspected appendicitis? So obviously, with appendicitis being an inflammatory pathology, we're going to suspect that there is increased inflammatory markers, right? So what sort of inflammatory markers? So they may be a raised CRP, right? And also a raised white blood cell count, so a leukocytosis, right? So raised white blood cell count, specifically raised neutrophilia, right? Now, raised neutrophils, because like we mentioned, and this links back to the pathophysiology of appendicitis, is there that you get bacterial overgrowth, right, after the increase in pressure and the lack of circulation, and due to that bacterial overgrowth, there can be an increase in the neutrophils, right, in the blood. Now, the other thing we can do is, in terms of testing, we can do a urinalysis. A urinalysis. So why might we do a urinalysis in appendicitis, right? Seems kind of odd, but the reason we do it is because say if we have a patient, a female patient, we might use it to rule out pregnancy, right? Could be, a similar sort of clinical presentation, especially if the diagnosis is uncertain. We might use urinalysis to rule out pregnancy, also to rule out any sort of urinary tract infections, right? And also any sort of kidney stones that might present with, hematuria, so blood in the urine. And we can use urinalysis to rule all that sort of stuff out that may lead us and guide us towards a definite diagnosis of appendicitis, right? Now, those are the sort of main testing that we do. In terms of imaging that is actually available, right? The very first imaging tool that we use is going to be an ultrasound scan, right? Now, on ultrasound, what might you actually see? So you might see an increase in the diameter of the actual appendix itself. So like we mentioned in the pathophysiology of appendicitis, is that there is that initial luminal obstruction, right? And because of that obstruction, there is a decrease in the outflow, right? And because of that, it causes an increase in the pressure within the abdominal wall, the appendix wall. And due to that pressure, it causes a ballooning and a stretching of the appendix itself. So that's why you may see an increase in the diameter, usually greater than 6 millimeters of the diameter of the appendix, which may also confirm appendicitis, right? We may also see the fecaliths, right, in the ultrasound scan. They call it appendicoliths, which is just classifications of the fecaliths that you see. So hardened fecal matter over time can calcify, and that may show up in an ultrasound scan, right? And the other thing we can also see might be thickening, right, of the actual wall of the appendix, right? So these are the things that you can see in an ultrasound scan. The other things that you can do, right, in terms of imaging for appendicitis, especially if, considering the diagnosis is very uncertain, we can do a CT scan, so a computerized tomography scan. Now, CT scan, obviously with its, ionizing radiation, it's more dangerous in patients who are younger, so pediatrics. We do not do CT scans, right? And patients who also are pregnant, for obvious reasons, we don't want to give the baby any sort of, dangerous radiation. So in that scenario, then we can do MRI scans, and both MRI and CT would give us a better direct visualization of the appendix, which will help us confirm the diagnosis of appendicitis. So that's everything in terms of the investigations for appendicitis. In the next video, we are going to go over the management options that are actually available to patients who are coming in with appendicitis. So stay tuned for that video, and I'll see you all in the next one. Thanks so much.